This session explains the objective and process of the assessment-based national dialogue exercise. It's followed by a talk on how the exercise was recently carried out in Indonesia. The assessment-based national dialogue is a way to plug in the holes in the social security system in a country so that the social protection floor can be achieved. The social protection floor seeks to ensure that 1. All residents of a country have access to essential health care. 2. All children enjoy access to nutrition, education, and care. 3. All people in the working age group have a minimum level of income security in case of unemployment, disability, sickness, or etc. And 4. All elderly people have income security through pensions or in-kind transfers. Different countries have different social security situations. For example, Thailand has achieved the floor for healthcare, but needs to extend social security coverage for the other guarantees. To conduct the assessment-based national dialogue, there are 3 steps involved. For example, building the assessment matrix, calculating the cost of completing the floor, and presenting the finalized assessment report. In Thailand, the entire process was carried out from June 2011 to November 2012. During each step of the process, all the relevant stakeholders had to be involved. It is important to highlight that assessment-based national dialogue is a participatory approach to implementing successful and coordinated social security schemes. It involves many stakeholders, including line ministries, local government bodies, workers and employer organizations, CSOs, academia, development partners, and so on. We now go into more detail on the 3 steps of assessment-based national dialogue.
So the first step, we will go very quickly now, it's building the assessment matrix. The first step is to identify what is the situation, the social protection situation in the country, to try to see whether this situation is whether the social protection floor is already in place or not. Okay? So we look at health, children, working age, the elderly. And we ask ourselves, is there a social protection floor for health already? Okay? What are the different schemes that exist for health? Okay? How many persons are covered? What kind of benefits do they have? Etc., etc., etc. Yeah? Is there problems? Are there policy gaps? Policy gaps, it means, for instance, that a part of the population is not covered in the legislation. Yeah? This can happen. Implementation issues, it can mean that although everybody is theoretically covered, in practice it's not the case, for many reasons. Mismanagement, lack of budget, whatever. We will see in details all the possible implementation issues that we can face. Yeah? And then we come up with some recommendations on how to improve the situation, meaning how to close the policy gaps, so it can be cover those who are not covered, or increase the level of benefits, or define a benefit package when the benefit package is not defined. This can be this kind of recommendation, and recommendation to close or to solve the implementation issues. Several persons have mentioned this morning that we have to work on the demand side and the supply side at the same time. Yeah? One of the recommendations may be, for instance, we need to improve the quality of healthcare, otherwise it doesn't mean anything to implement a social protection for health, because people, even if they have access to healthcare and there is no healthcare facilities, doesn't mean anything. Yeah? So we do that for health, we do that for children, for the working age and the elderly. Okay? As you can see, if you have a lot of actors involved, this cannot be done by bilateral consultation. It has to be done in workshops, like we do today, with many people. So this, I go very fast. Yeah. Once we have the recommendations, so the last column of the assessment matrix, or it is here in big, the last column, the recommendations, we want to cost these recommendations. And here we are going from step 1 to step 2. Yeah? One recommendation can be, let's develop child allowance for children. Okay. Okay. But what kind of child allowance? Is it a universal child allowance or a targeted child allowance? Is it for children from 0 to 3, to 0 to 6, 0 to 12 years old? Yeah? How much will you give with it, for this child allowance? Will you give 300 baht per month, 400 baht, 500 baht? So you need to be specific if you want to cost, yeah? So based on the very general and generous recommendations, let's try to transform them into some concrete scenarios that we can cost, otherwise you will never have a step 2 in your assessment process. And to go from step 1 to step 2, you need to be more specific, yeah? So within the recommendations, actually we have 2 types. We have some recommendations that we will be able to cost. This can be establish a new cash transfer, or increase the healthcare coverage for all the population with some basic social health protection package. This we can cost with the RAP protocol, with our costing tool. Yeah? Other recommendation, we cannot use the RAP protocol. These can be more qualitative recommendations, like increase the quality of education in Thailand. Okay, yeah? This requires additional studies. Yeah? It's much more complex. So we list them in the assessment report because it's part of the recommendations of this national dialogue, but we don't cost them. So we don't cost everything. Yeah? It can be also, like we had in Indonesia, establish an unemployment insurance for the formal sector workers. This is a recommendation which comes from the assessment of Indonesia. But we cannot cost that with the RAP protocol. RAP protocol is really something simplistic. To establish an employment insurance for formal sector workers, we need to do a proper study, a feasibility study, which is more complex. Yeah? So, the RAP protocol, very quickly, it is an Excel tool. An Excel tool meaning that you don't need to buy a software, you all have Excel, easy to install, easy to use. Yeah? Okay. Then you have a number of sheets, which are in blue here on this diagram, which are the sheets where you have to input data. If you don't input data, you cannot calculate anything. Yeah? So the data you have to input is on the population, not only the total number of people in your country, but the population by single age. And here starts the first complex issue, because in many countries you don't have it. You have it by group of age, from 0 to 5 or 0 to 4, etc. So here you really need to work on this population sheet, yeah, first. And then to project this population over the years, because you don't want only to know how much it's going to cost today, but you want to know how much it's going to cost in the coming years. Yeah? So this is what you have to do. And then you need to have also information on the labor market. You need to have information on some macroeconomic indicators like GDP growth, like inflation, all these indicators. Usually the Ministry of Finance have them, but in some countries it may be difficult to find them, or you need to work, as we did in Thailand, with some macroeconomists who have their own model, and then this model is being used by the government. And you need also to have information on the government budget, operations budget, expenditure and revenues. Why do you need that? Because the results of the cost in the end will be expressed in percentage of GDP and in percentage of the government expenditure. Yeah? So these are the sheets that you need to input, the blue sheets, and we will learn on Wednesday and particularly on Thursday how to complete these sheets. And based on this information and based on the detailed design of your scenarios, of what you really want to cost, you will be able to calculate the cost of the benefits that you are recommending to the government. Okay, you see, it's important to have data from 2012 to 2020, because you see that with some economic assumption, even if your cost will seem very high at the beginning, maybe it will decrease in the long run because of assumptions concerning the increase of the GDP. You think that, for instance, the country will develop, and therefore something which costs a lot today, maybe in the future it will cost less to the country as a whole. So here you have, it's not only one benefit package that will cost it, but a series, a whole set of benefit packages. So we costed, for instance, a package which includes disability allowance, pension, skills development, sickness benefit, maternity allowance, and universal child allowance. We didn't cost healthcare because in Thailand we assume, and this came from the recommendations, that universal healthcare is already more or less achieved. And you have two graphs here. You have one which is quite low and one which is higher, because we costed different levels of benefit packages, with a low assumption and a high assumption, just to give some options to the government. Okay? Once the costing is done, you need to know whether the government, given the projected budget that you have, will be able to finance or not this social protection floor. The additional costs related to the introduction of the new benefits. Yeah? So this is called the fiscal space analysis. In the case that the new projected budget of the government, so you project the budget of the government, including these additional costs. In case it is balanced, it means there is fiscal space. In case it is not balanced, which is often the case, it means that there is not yet fiscal space, and you need to work with the government on trying to find additional fiscal space. So how do you create fiscal space in a country? How can you create fiscal space? Tax. So you can increase the revenues or reallocation of expenditure. Yeah? So in both cases, but particularly in the second case, the government will do nothing if they are not convinced that investing in the social protection floor is a good idea for the country. Yeah? So in addition to working on these technicalities and all these numbers, you really need to have a strong advocacy power. From UNICEF, they commissioned a study called the rate of return of social protection. Yeah? So they show that in Cambodia, if they invest a certain amount on certain types of benefits in 2012, within, I think it's 9 years? Within a number of years, 12 years. 12 years. Within 12 years, they will, this investment will have paid. Yeah? Meaning that this kind of study can convince the government, and particularly the Ministry of Finance, because they have the concrete evidence based on the data of their country that investing in social protection pays in the end. Yeah? So the finalization of and the endorsement, of course you need to present the report. This is easy to say, huh? But it's not easy to do. Why? Because you have many actors now. Before, the ILO was working with Ministry of Labor. Okay, easy, you finalize your report, you give it to the minister, full stop, and then he does the work. Yeah? Okay? Now you have, for instance, in Thailand, we have Ministry of Social Development and Human Security, Ministry of Labor, we have Education, we have NESDB, which is the Planning Commission, a lot of actors, yeah? Plus workers, employers, plus civil society. So, it's more interesting as usual, but it's more complex, yeah? So before you start launching the report and publishing it and putting the report in the press, etc., you really have to ensure that these people who have been part of the process really endorse all what is in your report, yeah? And at the highest level. Because in these working groups that we have during 1 year, doing the assessment all together, we don't have the ministers there. We have the technical staff usually. Yeah? But now this report has to go to a higher level for each of these stakeholders. Yeah? So this is a bit complex. Ideally, it would be good to have a champion, like in Indonesia. We hope that the Ministry of Planning, Bappenas, will do this job. Endorse the document, take this report as their own report, ILO Bappenas or UN Bappenas report, and do the advocacy job for us, help us. Yeah? In other countries, it may be more complex. Okay? And then hopefully some of the recommendations will be endorsed, and the idea is that the UN system as a whole can support the implementation of some of the recommendations. So to convince policymakers, you can bring some evidence from other countries. You can say, okay, we advocate for a child allowance because we know that in this, and that countries that are similar to your country, this worked. And this had an impact. This is a way to advocate for the recommendations. Another way is to, as Cambodia seems to have started doing, is really to try to develop these models of return on investment to show that if they invest today in the social protection, in the future they will have a positive return. You can have other types of models to show the impact of this kind of benefits, or that kind of benefits on poverty reduction, etc. And finally, you have, I think, a lot of things to be done on marketing, communication, and all these things that we are forgetting sometimes.